Hey, you guys, I'm Nicole. How are you? And I am the CEO and founder of Exquisite PR Firm. And we are live tonight. You guys know at the end of the month, we have the awesome Dr. Otaka all the way from Ghana. This is his time, and we let him have the end of the month. He gets to tell us everything he knows. He fills our minds up, our bodies, and our souls as African American men and women. He gives us all the insights and things that we bodies. He's an amazing man. I've been on him for years. Um, I want to welcome him. And you guys know how it rolls on this show. I'm Nicole, and to the left of me, I have.
Otaka Dixon, Dr. Otaka Dixon.
All right. I'm King Jacob, you know, music innovator, social influencer, community activist, and most of all, you know, I'm here to get educated by Dr. Otaka, man. Like this is gonna be for men like myself, this is pure education and very informative because we never learn about things like these because it never comes up in a conversation. Men don't discuss stuff like this right here. So, with the doc, being on the live tonight, this is going to give me some insight of what a woman's body is subject to go through, something that I never knew. So, it's even going to draw me even closer to my queens, make me even salute them a little bit more.
Thank
Yes,
you very much. We're going to begin by talking about fibroids and its effect on fertility, the quality of life of a woman. There are a lot of misconceptions about fibroids. I just want to dissect fibroid a little bit. It's just a benign tumor. So when you're talking about fibroid, you're talking about benign tumor. It's not like something malignant. And another name for fibroid is myoma or leiomyoma. And fibroid is one thing that occurs in about 20 to 30% of women of reproductive age group. But it's quite a pity, it's underreported. In Africa here, we have a lot of women coming down with fibroids. And instead of going to the hospital, you find them in churches because they want the fibroid to melt. The pastors are going to say, your fibroid is going to melt in Jesus' name. Amen. And by the time they're coming back to you, they're already big and they've distorted the endometrial lining where the baby's supposed to sit when the woman gets pregnant and all that. So I want to go ahead to just talk a little bit. And it's one of the commonest tumor that results in hysterectomy. I wanted to talk about this when I spoke about the last topic, and Alicia Keys mentioned about 20-year-old having a hysterectomy in the state because of fibroid. I got so worried because I wouldn't make hysterectomy my first line of management for fibroids. I have done very huge fibroids. When you see such women, you probably think they are pregnant. They have what they call 36 size uterine fibroids. It's something that's going to take you like 3 to 4 hours for you to break down this huge tumor and give the woman a chance to be able to conceive and have babies. One thing you should know about fibroid, the cause is not known. But there are a lot of postulations that these are the things that lead to fibroid. One of the postulations says, okay, fibroid is as a result of what they call somatic mutation of a single smooth muscle cells in the uterus. And that is why a lot of fibroids could be, I have removed fibroid nodules in a particular woman of 71 pieces of fibroids. So if it is a somatic mutation of just one single smooth muscle in the uterus, it means that it could just go, several smooth muscles will mutate and then result in fibroids. So that is one postulation. Another postulation says, okay, fibroid could be inherited. My mom had a fibroid. It means that, okay, if there are some deletions or what they call translocation in the particular chromosome, the 11 and the 7, it might affect the children when they are growing up. So their children, the children of this woman with fibroid might come down with fibroids. And it's been found that those kind of fibroid with genetic link usually bigger. So I was talking to telling King that I have seen a 24-year-old girl with big fibroid. So you begin to wonder why. Why is this little child coming down with a big fibroid? There might be genetic link. There might be, oh, my mom had fibroid, and then he passed it on and all that. That could happen. And other things because fibroid is steroid dependent. As far as you're a woman, you are having your menses. The fibroids have the receptors for the estrogen. It also has a receptor for the progesterone. So those are the two hormones that agree together to get your menses together with the LH and FSH, and that plays a lot of role. So with the estrogen and the progesterone receptors located on the fibroid within the time of reproductive age, you are bound to get fibroid. And also, it's been linked that, okay, fibroid could have a lot of growth factors attached to it. That is why it grows. So those are postulations. But we're going to look at what are the people who are going to be at risks of having fibroid. One, the blacks. You remember what I told you? The black don't crack.
Right.
Yes, the blacks have higher estrogen. So if fibroid has a receptor for estrogen, it means we're going to propel the growth more when compared to the white. Are you there? Yeah. So you find out that for the African descent, whether you are born in America, whether you are born in Asia, so you have your black thing, and your black nature propels more estrogens, and that's why your skin is tougher in a way. So when you
Okay.
link that to people also who don't have what they call prolapse, the Africans don't come down with a lot of prolapse when compared to the Asians. So because even at your older age, your fat cells are used up to produce more estrogen. And that could help your pelvic floor and all that. So the same thing that the fibroid has the receptors for estrogen, and the blacks are more prone to having bigger fibroids when compared to the white counterparts and all that. And also the obesity has also been linked to fibroid because it's just the stem estrogen stuff. So an obese woman, a woman who is quite big, has fat cells and which could be converted to estrogen, and that propels more growth of the fibroid also. But that doesn't mean that the slimmer ones are not going to have fibroid. Once you're
Wow.
black, you have estrogen, you could. And there are some being, um, there have been some what they call xenoestrogens. What the society, what industrialization and the food and all that have brought to us. Before, people were used to eating organic meals and all that. Now people are eating tin foods, all sorts of things, processed foods and all that. So the xenoestrogens are found in some of these foods, and they are propelling the growth of fibroids.
Interesting.
Are we there?
So, yes, absolutely. So, depending on what you eat at a young age, starting at a young age as a kid could start the fibroid tumors. Like I can remember at the early ages of, like, before I started having kids,
Yeah.
when like my first pap smear, my very first pap smear came back abnormal, which scared my mom. And they had to do like one of those tests where they take a piece of, like, a biopsy,
Yeah.
and it came back like there was no cancer, but the cells were growing rapidly,
Yeah.
but there was no cancer. So those were fibroid tumors, like starting at an early age or something.
No, 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 no. Like I told you the last time, everything about the cervical cancer is more of the human papillomavirus. So
Oh,
the human papillomavirus causes a transformational change at the ectocervix, what they call the transformation zone. But
oh,
fibroid has to do with the smooth muscles. So it's just that the uterus has a smooth muscle, so there's a mutation on the smooth muscle, and that grows. But there's so many other things that could make fibroid to grow. But it's been found out that women who smoke,
mm,
smoking blocks is anti-estrogenic in nature. It blocks the estrogen, and actually they are not able to have bigger fibroids and all that. Sometimes they're not even able to have fibroids. But I'm not saying that because smoking has a beneficial effect on fibroid that women should go smoking.
okay, okay, okay. I was about to say, huh? Good.
No, no,
I
no,
thought
no,
it was
no.
about to
That
be a
is
good idea.
that is just one thing they found that. But if you go smoking, you're gonna kill your lungs. You're gonna
Right,
cause some
right.
problems
So
at your
it's going to be
liver
something.
and all that. Because smoking has also been implicated in a lot of cancers, even ovarian cancer, even endometrial cancer, and all that, even cervical cancer. Because smoking depletes the fighting agents at the level of the cervix. So once it depletes the fighting agents, then you are prone to having cancer because the human papillomavirus is going to defeat your immune system at the level of the cervix. So if he's having one effect here, I beg you, in the name of God, do not go taking that because it has some little effect on the fibroid.
Okay, well, what you did, Dr. Otako, was you sent over these amazing, I mean, amazing pictures of you in surgery. And when I tell you guys tonight, we're doing an adult show. So if your children are watching, if you're under the age of 18 and you guys um, do not have parental guidance and you guys think that you are not available, or you guys think you need parental guidance to watch it, then I think you guys should turn it off. If you're not an adult. But if you are an adult and you would like to see something amazing, then tune in and get close to the screen. Because Dr. Otaka is about to take us on a journey. All right. Is it okay if I start to show these pictures?
Yeah, you can.
I'm gonna take myself out of this show tonight. I know I look a mess, you guys, because it really didn't matter because it's all about Dr. Otaka tonight. But we're gonna go ahead and start to show you guys these things. I'm gonna start with you. I just like him, y'all. I love him so much. He's been my friend for so many years. Look at him. Look at this. Look at this. Can you guys see this? Is this
No,
Mm-mm.
we can't see it.
No, we
uh,
can't see it.
we're talking because it
Yeah,
needs to
yeah,
be
yeah,
Yeah,
yeah.
we
We can
can
see
see it
that.
now.
okay. So we got Dr. Otaka here. Dr. Otaka, explain what this is.
Yeah, so this is a multiple uterine fibroids. Looking at that, you have more of intramural. So that brings us to the classification of fibroids. So there are some fibroids which are found in the innermost layer of the womb, what they call the endometrial layer, that's submucosal. Then you have some in the muscle layer of the womb, which is called intramural. You could have some fibroids sitting on top of the womb, called a subserosal fibroid. And then you could have fibroids sitting on top of the womb, supplied by the womb, but get an additional blood supply from maybe intestine or omentum, all happening inside the abdomen. So that is known as the parasitic fibroids. So you could also have some fibroids located at the broad ligamentary, even at the level of the cervix, you could have fibroids, cervical fibroids. So there are several locations of these fibroids, and based on their location, they're going to give you the symptoms. If the location is at a place maybe intramural, it's not giving a lot of symptoms. 50% of fibroids will not give you problem, but there are strategic locations where the fibroids will be, and it will definitely going to give you a lot of problem. So in this woman is a kind of hysterectomy, wherein we just remove the total uterus including with the fibroids, the cervix, and everything gone, because she's completed the family cycle or something like that. So we just, this is a hysterectomy specimen where the fibroid was just uprooted together with the womb, the eggs, everything out of the client.
So is that what that is? That's everything?
Yes, everything here.
Okay.
Wow. Whoa. You
That's
you just broke down.
amazing. Okay, so that's what that is, you guys. That is Dr. Otaka,
Yeah,
and that is him and his staff. That is the inside of the woman's body, and
yes,
that is the whole. That's the uterus, the fallopian tubes, the ovaries. That's just the whole package. That's what the baby is held in. That's what the baby grows in, and that's just everything. The cervix.
yeah.
That's the whole package that he has in his hand. And that's the lady laying on the table. That's his
So Nick,
staff.
yeah, Nick, you can just show the fibro nodules. There's one I get sent to you that has just multiple nodules of the fibroid.
The one in the bowl or
Yeah,
this
the one
one.
in the bowl. No, this is one of the biggest fibroid I've ever operated on.
Oh, that one was.
Yeah, this weighed almost like 7 to 8 kilograms. It's so heavy.
Biggest fibers that you've
It's
ever
so
taken
heavy.
out.
Yes, this is a total hysterectomy specimen. So when you look at this woman was about 48 thereabout. You would think that she's pregnant or she was pregnant, but actually this is a whole fibroid. It has distorted the total anatomy of the womb. So you can actually say, okay, this is the endometrium. In this, the endometrium is
Wow.
shattered. The innermost chamber of the uterus is shattered. So going to operate on this, I said, oh, the best bet since you've delivered would be just to take out the uterus. So this is a total hysterectomy specimen. We just took out the whole thing off.
Wow. Wow. I think we just got some messages in from some people.
Can you put the messages on the screen, Pavani?
I will. Yes, sir. Hold on 1 second.
Okay, so let's move on a little bit for the what. How would someone know that they have fibroid? There are a lot of clinical features. There are a lot of clinical symptoms. Like I said, 50% of the fibroid will not give you any problem,
Okay,
but
you
the
said the
remaining
one
50 will give you a lot of problem. And most commonly, it starts by changing your menstrual cycle.
oh, this is what you're talking about. You said this right here in the bowl?
Yes, yeah, these are the nodules. So I've once removed 71 of these in one patient. So it's like you have multiple nodules of the fibroid, and this explains why it's a somatic mutation of just one single smooth muscle in the uterus. So they could have multiples of mutations in different small, a kind of smooth muscles in the uterus and all that. You have them like this. So these are how fibroid looks. And I don't know how a pastor could say this will melt. So scientifically looking at this, and it looks like biscuit bone. It's hard, it's nodular in nature, and I don't think this can melt. But that is a spiritual aspect. But looking at physical aspect of this, it wouldn't melt anywhere. And there is no amount of herbal medication, some drugs that's going to melt this. We
Right.
have some scientific medication that can reduce it in size a little bit, but it's not going to melt it. They will still be there. Once you stop the medication, it's to start growing and proliferating again.
And so the pastor told them to pray them away.
The what?
You
Yes.
said the
And
pastor
that's the
would tell
major
them to pray
problem
them
why
away.
people
And this
come
looks
late
like
to.
calcium. Like these look
Yes.
hard like bones.
Yeah. So I'm using this medium to tell women that look, this is not a church something. Just come to the hospital. Once CAPS fibroid is dictated early, anything you dictate early, you can take care of it. And it's not every time we see a fibroid, we go operating on that. No, there's what I call expectant management of fibroid. So if fibroid is just 1 centimeter, 2 centimeters, I'm not going to touch it. I'll tell you, you could have babies with these little fibroids around it. But once they are massive, once they are causing you problem like menstrual cycles and all that, so fibroids could make you have heavy bleeding during menses, bleeding with clots. It's not quite common for you to start bleeding with clots. An average woman is supposed to lose like 75 mils during menses, 75 mils of blood during menses. But you see, fibroid will cause you to lose a liter, 800 mils, 2 liters during menses. And the people are bleeding out and being transfused, bleeding out and being transfused. No, you need to go to your doctor. Do you understand? So the
Yeah.
commonest symptom is just abnormal uterine bleeding, because if this fibroid is all enveloping your womb and during your menses, one of the processes in which you bleed more is because it wouldn't allow the other smooth muscles to contract effectively, and by so doing, you lose more. If the fibroid is situated in the innermost chamber, what they call the endometrial cavity of your uterus, then you're going to bleed more, because it's going to widen the endometrial cavity and you're going to bleed more.
Wow.
So his fibroid is so huge, intramuros and all that, the ability of the uterus to contract becomes difficult, and you're going to bleed more. And sometimes the submucosal, the one in the mitral cavity called the submucosal fibroid, could have ulcerations, could have some ulcers in it. So you finish bleeding, you finish having your menses for 3 to 5 days to 7 days, and then you're expecting to see your menses next month, and then the fibroid bleeds again. So
Right.
in one cycle, you having bleeding twice, thrice, and all that. No, it's not normal. You just need to see your doctor.
Right. That had happened to me, and then they were like they put you on birth control pills, and they do all kind of stuff. They put you on birth control pills, and they say that doesn't work, and then after
So
like
those are
35.
the things you look out for. And sometimes also fibroid could cause you a lot of pain.
Yes, yes, yes,
My
yes.
God. The pain of the fibroid sometimes when you're having your mens is a very excruciating pain.
And it
You know?
makes you so, it's almost like a mind thing. So it's like you're fine or whatever, and then it's like as soon as you see the menstruation, as soon as you see the
Yeah.
menstruation, like you see the visual, that you see see the blood or the menstruation or whatever,
Yeah, you start having pain.
all of a sudden excruciating pain, and then you're super sleepy. I could sleep for days, 2 or 3 days, and just I can remember calling you just like I'm
Yeah.
so I don't
So
know.
it could cause you a lot of pain.
I
And
couldn't
apart
get
from
up.
that, also the subserosal, the one sitting on the top of the uterus, who have a pedicle, just a small leg, and they can twist. So if something has a pedicle and they can rotate, you might be doing something, it might even during sex, and that twist on his own, you start having pain.
So sex was
Wow.
horrible. Sex is painful, and
So
and it,
some fibroids which are located at the posterior wall of the uterus, when someone is having sex and the dick hits the cervix, it transmits pain. So
like
I,
right up
I
the
don't think the
buttocks.
guys should be blaming the women sometimes when they have severe pain during sex. Some of them could just be posterior fibroids, which when you hit the cervix with a dick and then the pain starts.
Right up,
So
right,
when
right
you
up the
notice,
buttocks.
when you're
Right.
experiencing such thing, you need to see your doctor. Sometimes also the pain could become perpetually chronic pelvic pain. Every time you're having pain, and even fibroid coexisting with pregnancy could give you pain. So there are several ways you could have pain during menses,
Intercourse.
even when you're not having your menses. Fibroid could undergo some certain changes. There are several changes that could occur in fibroid. You have what I call calcifications, degenerations, fatty degenerations, All manner of these genetics, they could cause you pain.
What is the pain that feels like the electricity in your buttocks area? Like a sharp pain in your buttocks. Like, I don't
Yeah,
know.
depending, because fibroid could grow so big that it's occluding the rectum. So with fibroid, you could have some pressure symptoms, what they call pressure symptoms. Depending on the size of these fibroids, you could see the fibroids causing problem with the kidneys because it's
Wow.
resting on the ureter that carries the urine, and that
Mm-hmm.
causes some
Mm-hmm.
reflux, and the kidney begins to get enlarged.
Wow. Yep.
The
Make you use the
ureter
bathroom most
itself
time.
begin to get enlarged.
Wow.
So if the fibroid is resting on the rectum, then you have this person having persistent constipation
Bottom
every time.
pains.
You
Yeah,
have
like
abdominal
sharp
pain,
pains in the
constipation, and
buttocks.
all that. So the
Yeah.
fibroid could be resting well on the where the bladder is, and that predisposes you to every time you wee wee frequency. It's just every time you go want to wee wee, every time you go want to wee wee, every time you go, and it could even cause some
Like an
a kind
old
of
person.
obstruction. Fibroid can actually
You.
cause obstruction that they have to pass catheter to drain your urine. Do
Yeah.
you understand? So it
It's
has a
awful.
lot. When fibroid is resting on the pelvic veins, that could even transmit some obstruction. So with the pelvic veins, you have some form of varicosities in your legs. You have varicose veins and all
Mm-hmm.
that. Sometimes they can become inflamed, thrombophlebitis and all that. So there are a lot fibroid could do. So my advice would be that the women should seek the help of the doctors. So, like we've talked about, some of the common symptoms of fibroid. So, how do we diagnose? How will somebody say, "Okay, I have fibroid"? You can only diagnose that when you go meet a doctor. From the history, the symptoms you're presenting with, without even doing a scan, might tell you, "Oh, I think you have fibroid." So
Mm.
when I examine you, I could just examine your abdomen and say, "Oh, you have a huge mass here." But because the mass is nodular, it's rough in shape and all that, I think you might have fibroid. Sometimes it could be smooth, but it's big. I say, "Look, this is fibroid." So the
Mm.
essence of the scan, doing ultra scan, is for you to be able to confirm what you already knew or what you already have in mind that this might be the what the woman is having.
Wow.
Okay,
So
so
So,
if the
so
fibroid is
when you
occurring in advanced age, like 60 something, I wouldn't want to just use scan. I want to do an MRI because
mm,
a woman had fibroid at 50, and then it's expected when you time you get into menopause that the fibroid is supposed to shrink a little bit. But instead of the fibroid shrinking, it's rather growing bigger.
wow.
Then I'll be suspecting that this fibroid has become malignant, what they call sarcoma. So it has
Mm,
undergone sarcomatous change. So in
mm.
trying to know, you see a big woman, advanced age, 60, coming down with abdominal mass, and it's not from the ovary. And their previous history, probably she had fibroid when she was younger, big one. You should be able to know that, this is actually undergoing some sarcomatous change. Do an MRI. MRI will be able to tell you this is a sarcoma.
oh wow. It's so
Mm.
it's sarcoma like a cancer?
Yes, sarcomatous change. Sarcoma is when the fibroid has become malignant.
Okay. Yeah, I know that sarcoma is a cancer. Okay. Okay. So can I ask a question? So what is this?
Yes, so we just open the woman up. The fibroid is just all enclosed inside our womb. So I want to start shelling them off. So the first one, the incision you saw there is I'm holding a fibroid. I just want to shell it off. So these are intramural fibroids. So this one is a huge fibroid. This is what they call parasitic fibroids. If you look at the body, you have a lot of blood supply. Do you understand? This was a fibroid which was resting on top of the womb, but got other supplies from omentum, from the intestine, and that made it so big. So, but
Wow.
this is the easiest to do. Clip it off on each pedicle, and it comes out, and then you just have to detach all the blood supply around the fibroids.
So how long does this take?
Fibroid is a very slow growing tumor. Unless it's sarcomatous in nature, then it grows very fast. So you could see that this might take this woman like 5, 6 years, 7 years to grow this big.
How long does the surgery take?
Depending on this took very fast because it was just on the top of the uterus, but the ones on that showed you, which were in the small basin or something like that, that could take you 3 to 4 hours. I have removed 71 pieces of fibroids in one woman, and it took me like 3.5 hours to finish the surgery.
Wow.
Yeah.
Okay. So let's go over.
So this is just the starting of my mech. So after that, what I showed you, after I removed the fibroid, this is how the uterus looked like.
The healing
Go back.
process?
Go back to the second one. Go back to the second one. Yes. So when you remove the fibroids and all that, shell the whole fibroids of that, you repair the womb. That is how the womb looks like. So at this stage, I was done with the surgery. So what I had to do just to push the womb in and then fix the abdomen and exit the theater.
Okay. And
Yeah,
then that's
this is
what it
how.
looks like to sew out.
Yeah, this is how it looks like after you finish your fibroid operation. This is another huge fibroid. I think what we did a hysterectomy. That is the hysterectomy specimen. We removed everything about this fibroid. Yeah, that is it.
Okay, that is it.
So
Besides this
fibroids
right
could
here,
also in terms of the quality of life, women living that experiencing pain. I have ball pain in my life. I told you when I had ball pain in my life. You can't actually make pain your friend.
I think we didn't miss this. I think we missed this one.
Yeah, this is another huge fibroid.
Just with all these things on it, all the
Yes, yes.
tumors.
So you have
Is this
intramural.
the one that
You have
turned
some
into?
on top. Yes, you have some on top. That is the subserosal. The some inside the womb. The ones you are seeing on top of the womb is subserosal fibroids. So when you cut the womb open and begin to remove them, that is the intramural. And then in the innermost chamber of the uterus, which is endometrium, you could have the submucosal fibroids.
Wow. Wow. And then
So
this one, we didn't get to this one.
Yeah, this is a hysterectomy. You just removed everything together with the womb, with the fibroids. Then you're going to send it to histopathology. Over there, they'll tear the whole womb into pieces just to make sure they're only fibroid, because sometimes you could have fibroid coexisting with what they call adenomyosis.
Wow. And that's the heaviness.
Yes.
How
So
pregnant does that woman look? Does she look really big? With
yes.
that, yeah, her
Yeah.
stomach. So that's
So
the
you
woman that
might think
walks
that this
around with
woman
a
is
big stomach.
pregnant 2 years, 3 years, 4 years. The woman is not delivering. And what are you going to deliver? You're going to deliver fibroid? No. Fibroid has to be operated upon. So they keep going to church, they keep going to
You
one
see
thing,
how the
keep taking herbal
personality.
medications. And the worst people that I don't like to listen to, I always tell my clients, please, before you listen to they say, please ask me first. Before you say, tell me your grandmother said, I want to be asked first. My grandmother said this, my mother said that, my this, that. I don't want to listen to they say people.
Right.
They say,
Right. You've been
everyone
in,
knows
right.
something.
And I can understand that. You've been in school over half your life. You've been in school well over. I know. I've been knowing you for a long
Yeah,
time. And I was in school.
so it's like that. So
So
how
I know
do
you've been
fibroids
doing at least
reduce the
18,
quality of life
20.
of a woman? How does fibroid reduce the quality of life? By causing you a lot of pain, by you bleeding and bleeding out and being transfused because of the heavy flow. You can't go for occasions and all that. While other women are out there, you don't know when the fibroids will cause you to start bleeding and you start soiling yourself in occasion. So they don't want to go there, you know. So why don't you see the doctor? And then because of huge fibroid, you're not getting pregnant. You've been married for a long time, but you won't be able to get pregnant because there are several ways fibroid could cause infertility. One is that if you have fibroid in the innermost chamber of the uterus called the endometrial cavity, when you have sex, what the sperm does is that the sperm moves from the vagina where it's been deposited into the cervix, and the sperm moves at 6 millimeter per second.
Wow.
6 millimeter per second. And this sperm is expected to travel the whole of the endometrial cavity, meets the tube. The tubes are two, so it makes the tube pass through the ostium, what they call the opening of the tube, and then enter inside the tube and goes to where they call the ampulla of the tube. Because when a woman is menstruating and you release an egg, so the tube has a long hand which picks the egg and brings it to the ampulla. So your sperm is supposed to travel to the ampulla to meet the egg, to meet the queen, get the queen pregnant, and then move the sweep. By the tube will sweep the egg like that for like 6 days, and then they come back into the endometrial cavity, and then the fertilized egg hooks up onto the mother, establish a contact, and the baby start growing.
We're aliens.
And if
so let me get
we're
this straight.
Aliens. That's what I just heard you say. We're aliens.
So
we are aliens.
So let me get this straight, Pavani J and Dr. Otaka.
That's what we're aliens. That's what he said. That's what he said. That's what I got.
Let me get this straight, man. So you have females that come to you and say, my mama said, my grandmama said, oh, my pastor said. But
yes,
at the same time, this fibroid is growing inside them constantly. And, you know, and what we need to ask while the fibroid is growing, what is the quality of life between her and her husband?
Yes. Because most time when a man wants to enjoy, maybe probably you're in pain. So it reduces your quality of life.
Can't do it.
Most time when the husband needs to enjoy, you are having what they call intermenstrual bleeding. You've seen your menses before, float for 4, 5 days, 6 days, 7 days. And then when the man wants to enjoy, you start bleeding again.
That's a no.
So sort it out. So you just sort it out.
Unless they do that, unless he, does that type of stuff. You're married. I don't know. At some point, some people do that. Because, you can't always say no. He's not going to always accept no. Like, if you're bleeding 28 days out of the month, what you going to do? Right.
Yes,
it's
some
a problem.
men wouldn't want to go in there when you're bleeding.
No, because it's a smell. It's a feeling. It's dirty. It's sandy feeling.
Yes, because blood has some certain odor and all that. So some men wouldn't go there. So why not see your doctor and get this fixed? So even if it's that expensive to do fibroid operation in the state, you can come down to Ghana and get them arranged.
Right.
That's a lot, man. That's a lot. And I never knowed all this, man. So Pavani, you really set me up tonight. You really did.
But even outside of that, did you hear what he said about even just getting impregnated?
Yeah.
What the sperm has to do to get attached to the egg. And then what the egg has to do to get attached to the fallopian tube. And then the fallopian tube, when it travels, and then attach itself to the urinary wall. Doesn't that sound alienish to you? That's like we're aliens.
You know what it sounds to me?
It's not, but it's a beautiful thing.
You know what it sounds like to me? You know what it sounds like to me? It sounds like the penis. It sounds like the penis is a missile launcher. That's what it sounds like.
It's a magical thing. I wanted to be obstetrician is to watch to watch
Oh
life
man,
to what you know this Dixon
yeah.
So
or
the
Dr.
ways
Otaka,
in
I'm sorry.
which, yeah, the ways in which the fibroid will cause the woman not to get pregnant. So if you have a huge fibroid, so if he's going to take the sperm like 2 days to travel the cavity and get to where the egg is, the fibroid will enlarge, will increase the surface area for the travel. So if
Right,
the nature has made it that it's just supposed to get there in 2 days, so if he can't find his way there, it dies inside the cavity.
right. So nature has made it so you got so the brain of the brain of semen the
Yes,
life of semen has 48 hours. You got 48 hours to get to your destination. If you don't make it, you
yeah.
die.
I'm saying if it's supposed to be for the, because sometimes the sperm can survive for 5 days, 3 to 5
Whoa,
days.
what type of
So,
sperm is
but
that?
yes, because that is why we're the king. So the king survives. The egg survives only for 24 hours, but the
Okay.
sperm survives for 3 to 5 days.
Oh wow.
What did
Yes,
you say for Money Day? What kind of what?
Sperm is
we
that?
are the king.
Oh
So the
my.
sperm survives for 3 to 5 days, waiting for the egg.
Yeah,
So
okay.
if the cavity is distorted
Predators.
by the
That's
fibroid, if the cavity is distorted by the fibroid, it wouldn't be able to get there. Sometimes the fibroid could go block the two ends of the tube. There is a video I had. The fibroid was just sitting on the tube, and this little girl couldn't get pregnant. Immediately, I got the operation done. Within 5 months, she got pregnant.
oh, okay.
Yeah, so I had to excise the fibroid from a different angle so it doesn't damage the tube. So it was just on the top of the tube, on this side, and all that. So if the fibroid is blocking the tube, the sperm can't pass through.
Oh, okay, yeah. Yeah, I understand. This is
Fibroid
what
So
with okay,
Doc, after you remove the thyroid tumor and after she goes through her healing process, you know, normally what is her sexual life like after you remove the thyroid? Is could she still get pregnant after then, or is it
yes.
certain? Okay, okay,
Okay,
okay.
let me show you this woman. I actually operated on her and I told her, don't waste time for me. 4 months down the line, she got pregnant.
you so silly.
Sorry, I got to just show you this. This beautiful woman, I operated on her, and 4 months down the line, she got pregnant.
She's
And then I delivered her baby, and I told her, because once you've had a myomectomy, there's likelihood of fibroid growing again. So don't waste time. So we did it like that. Don't waste time. Don't waste time. She got her 4 babies. She had 2 boys, 2 girls within 4 years. And she went on Facebook. She wrote, I have been operated upon 5 times, but I have 4 kids.
okay.
Okay, okay,
So
okay.
once you operate on fibroid, the woman stands 30 to 50% chances of having her life improved in terms of sexual, conceiving, and all that.
Okay. I'm done.
So, Doc, let me ask you this. I have a lot of females in my family, and a lot of cousins, a lot of female friends that's into different professions and stuff like that. And I'm going to tell you, after we get through with this video, I'm going to save it and I'm going to put it in all of their messengers. Because
Yeah,
this is something you need to know. And I can guarantee you they don't know about this. I guarantee you they don't.
yeah,
I can guarantee you, and I'm gonna tell you why I think they don't. It's because a lot of people don't like to discuss and be open about the body, as far as the understanding the female body. So when you ask a female to help you understand her body, or to talk about the naturalization of a female's body, and what they go through and what
They don't
could
want to
happen
discuss
if
that.
this
Yeah,
happened.
sometimes they don't want
They
to
don't.
discuss that.
Yeah, they don't want to discuss
Sometimes
it.
they're ignorant,
But
ignorant
but you're
of that.
not you're not asking because you're being smart. You're asking because as a male, you definitely want to educate yourself. And if you say that we can have an open discussion, why not let this discussion be open? Because not only are you definitely helping me, but it's some informative information that most males need to know, and most males never encounter to know this type of information.
Yeah,
So, you know,
Thank you so much. My um, I want to thank my mentor. And I have to say this out loud, Cheryl Dunlap. And she's my mentor, and way back in 2013, 14. If it wasn't for her, I would never be here. And Dixon, sorry, Dr. Otaka, I think that you remember me talking about her all the time.
yeah.
And I used to say that she looked like an African princess, and she still does. And she's on WRLR. You guys still can tune in to her Wednesday nights, 8 or 9 p.m. And she goes live now, and I'll promote her to the end. And I love her like she's a sister, and I still do, and I always will. And she said that she's very proud of me. She's very proud of this show tonight. You are amazing, because people need to know this. And he says thank you. He said this is an excellent show. And when I say that she is in, when I say I don't deal like with a lot of monotony, and I was taught that by her. Um, she's excellent of excellence. When I say excellence of excellence, um, she's the epitome of excellence. Um, I watched her walk across the stage. She has a daughter that's beautiful, grandchildren. She doesn't have one daughter, but she doesn't have a lot of children and all that. Like me, nah. She has one daughter, and her daughter is excellent. Um, but when I say she has held her head up high, and she's like master degree and all those things, theology and all those things. So for her to say something is excellent, it has to be good. Cause you ain't getting good.
Thank
You
you.
ain't getting okay. You doing good if you get a out of her. That's what I'm saying. You get it.
So the last thing I want to tell the audience would be that you can actually conceive with fibroid depending on the location. Like I said, the symptoms fibroid gives you is dependent on the location, is dependent on the size of the fibroid. So many women can conceive with big, even some with big fibroids, but there are quite a lot of complications associated with that sometimes. Fibroid could make you have preterm labor and deliver premature babies. Fibroid could cause a lot of miscarriages. For example, the fibroid situated in the innermost chamber, which is endometrial cavity, called the submucosal fibroid. So when the baby travels to make contact with the mom in the uterine wall like that, it could implant on the fibroid and wouldn't know it's fibroid because it is just at the endometrial cavity. And then as the baby start growing, fibroids start growing because the pregnancy is maintained with the estrogen and all that. So you are supplying fibroids and a lot of estrogen. So the baby start growing, baby fibroids start growing. So the fibroid will definitely going to hit the baby out. And sometimes the placenta of the baby could implant on the submucosal fibroid. And as the baby grows, the fibroid just shells the placenta and the woman will have what they call abruption. Abruption is just separation of the placenta and the woman start bleeding. So fibroids is the common cause of cesarean section happening with people is just because of the fibroids. Because if the fibroid is occupying the lower segment of the uterus where the baby is supposed to come out from, and the baby can come. So you just got to get the woman operated on. There's a woman I operated on, it was so big. The fibroid I removed before the baby came out was like the head of, is bigger than the head of the baby.
Mm-hmm.
Yeah,
Okay.
so I wouldn't advise women to get pregnant with huge fibroids. And if you see some clients who are doing IVF and you have a fibroid, the IVF center will want to do the fibroid operation before start. They don't want any obstacle in their way. So they want to remove the fibroids to make sure that the womb is fine. So if the fibroid is going to be there, it's not going to be big. It's just be about 1 centimeters, 2 centimeter fibroids, which will not cause any problem to counter the effect of the IVF treatment and all that. So fibroid is real, and the best way to get it is just detect it early. Go to your gynecologist, get get a counseling on how to go about it. Don't go to the pastors. They don't know anything about the anatomy of a human being. You know, don't go there. I will say it. I'm going into Nigeria today by God's grace, and then I'm going to teach in a church. I told my pastor I need to come to your church and teach, and the topic of that is it is not my portion,
Mm.
because you see every woman may say it's not my portion when it got to do with medicals. No, if it's not your portion, whose portion is it going to be?
Uh.
So that it is not my portion has driven a lot of people out there to go kill themselves.
Huh.
Because somebody might have an accident and then you just have a fracture, maybe of your limb, and it's what they call simple fracture. And the fracture is not a kind of displaced. So what the doctor wants to do is to just take you to theater, open up that after the x-ray, and fix a pin. The fracture heals and you go back to theater several months, then they remove it, and it's not going to cause you any problem. You can still do whatever you want to do. But what they were going to do is, oh, it's not my portion. If you go, they're going to cut my legs. So then you'll be driven to go see a bone setter, a traditional bone setter. By the time you get there, this guy does not have the eye of an x-ray. So
Wow.
this guy touches the legs and all that, and it's okay. We're gonna do it like this. They use something to wrap the leg and make some incisions and put one or two things, and then your leg gets infected. So they are bringing you back to me, infected leg, which might kill you. And looking at it, I don't want you to die. I want you to lose one leg. Then
Mm.
that becomes your portion.
Mm.
Because if you had
Mm.
come to me earlier on, it's not going to be your portion. So human beings, we just need to educate them, because the religion, in a way, is interfering so much with scientific evidences and with medicine.
Wow.
So if I tell you, come, the fibroid is just like 10 weeks, 20-week size, 16-week size. No, it's not my portion. The pastor must pray that the fibroid should melt. When you go all around and you come back in 5 years to come, it has distorted your womb. It has distorted your endometrial cavity. I will tell you, madam, I'm not going to operate on this. I'll just got to take everything off. Then it becomes your portion.
Mm.
So the delay is what causes the problem. If you don't delay, you come, you get everything. Like this young lady who had got 4 children, 2 boys, 2 girls. I cut your fibroid off and nothing on the way anymore, and you got all your babies.
Mm-hmm. Mm-hmm.
And sometimes it might just be, if I have a fibroid sitting just on top of your womb, I just go there and cut it off. It wouldn't stop you from having a normal vaginal delivery. But if you get into the innermost chamber, the endometrial cavity, then I'll tell you, look, you're not going to have a normal vaginal delivery, because if you subject such uterus to the intensity of the labor, you're going to rupture your womb.
Mm.
Yes.
Okay.
So we need to do more of the education so that people don't pry on the weakness of people and then mess them up in terms of medicine. And that is why you see me doing this boldly, because I've seen quite a lot of things. I've seen maybe more than 1,000 fibroids in my profession. I have operated maybe more than 500.
Mm.
Right. So over here in the States, they do hysterectomies too soon then. So instead of them removing the fibroid tumors and how they just go in and just take
You
out
don't
our
blame You don't blame them, because your system is quite different. if somebody is not used to seeing the level of the big fibers that I do see, the person wouldn't know how to go about it.
Mm-hmm.
You can go in there and make some mistakes.
Okay.
Do you understand?
Mm-hmm.
So you have to approach them when it is small, when it is something somebody can handle. But when you have these massive things that are going to keep you standing for 4 hours, you need to have a lot of units of blood and all that, because sometimes it could bleed. I once had a uterine fibroid that was 36 week size. It was up to days on a woman. And the German who was going to operate assisted me, said, "Are you going to operate this? Are you going to do a myomectomy on this?" I said, "Watch me do this." And he said, "Do you have Pitricin?" Pitricin is like a medication which, when you're operating on such big fibroids, you could just sprinkle it on there. It causes vasoconstriction of the vessels. I said, "No, I don't have that. But I have my technique. I'm going to use something to tie at the level of the uterine artery, and then you have a bloodless surgery." And that was what we did. The white old man took my pictures, and he was so impressed, because we removed quite a lot of nodules of this fiber from this huge mass. So once you come early, things can be done. And if it is because of money, because sometimes they are so big. I had one that came in from the States that had to come over here to operate on her. I didn't charge much. Over there, it might cost you like $15,000, $20,000. But here, I wouldn't charge you that. And you will get it done successfully. Go back there, do your IVF, get your babies. Nobody should just go straight to hysterectomy. It's not the fibroid could be managed expectantly. Okay, let's give you time and see whether you can get pregnant. After that, if you can, okay, let's do a myomectomy for you before going straight to hysterectomy. And there are several ways you can do that. Laparoscopic surgeries will remove the small fibroids. You could have a submucosa. Somebody goes through what is it called, and just get the fibroids out. Hysteroscopic surgeries can just go to remove the small fibroids out. Laparoscopically, you can just go remove the intramural, the subserosals, and all that. But the bigger ones, I wouldn't want you to go removing that. No, open the woman up, see what you're doing, control the bleeding, do everything successfully, and then close her back.
Wow. Just amazing. Just the fact that I heard that you just said that you're going to use your own technique.
Do you have questions for them before I go to sleep? It's almost 3.
I'm so tired. No, what are you, the question, what are you in the next 5 years? Next 5 years. What are you looking forward to doing with your career? Where are you looking to be at?
Like what I'm doing now, I want to be in the next 5 years. I want to be a motivational speaker. I want to teach people. These surgeries come with a lot of disadvantages for people like me. We're big. So big people are prone to back pain sometimes and all that. So in this active stage, I have done quite a lot. Now I'm having some back issues. So if I have this fibroid, I'm going to operate for 4 hours. You're going to pay me big for me to do that. Because after that, I have to just take care of my back issue. Because you're going to stay like this in operating a woman. So I rather want to do something like giving talks like this, teaching people, enlightening people, and do smaller, unless it is necessary that I have to operate on bigger surgeries. That's the only time I could go. So as you're aging, you just need to taper down on the things you do. And encourage the youths, to be able to. And I'm so versatile, and I want to teach the young ones. Anything I'm doing, even in the hospital, I want to bring you forward. You got to learn it. Because I don't want you to go kill somebody that is close to me with that, because you didn't learn what you're supposed to have learned. So I bring you forward to teach you.
Yes. You got any questions for
But
me?
aesthetically, I want to even I'm doing some aesthetic was program now. by the time I'm finished, I'm certified by the American board. That's fine for me also.
I I I think that he would be a great asset to John Hopkins University. And if you know anything about John Hopkins University, that's the best university in the United States of America when it comes to medical students that wants to become any type of doctor.
Yeah.
Yeah. So I think that he would be a great professor, great professor. So
I
and I'm
think you're
hoping,
an awesome professor anyway. I think you're an
yeah,
amazing teacher. You
yeah.
are.
So and I'm hoping I
Seriously.
can see that, Doc. I'm definitely hoping I can see you come to the States and educate.
Soon.
No problem.
Or within the next 6 months to a year if something happens with some other things that we have growing. Get over to Ghana. Um
Yeah, yeah,
we
definitely.
I missed the trip in March that we had. I missed it because we had something set up for Nigeria and then Ghana with the girls trip and I missed it. And so if something comes up again where I may have the opportunity, then yes, we will butt pads. But if you come over here anytime soon, then we will butt heads with you being in the
No
States.
problem.
I am
So
so
let's teach
appreciative.
the women. The women need to be liberated from some misconceptions and all that.
You
They're
guys know what
wonderful
time it is.
people. If you have a problem, let's get it solved. So
Absolutely.
even after this video, they could ask any question they want. I will just give them the answers and all that.
So you guys heard it yourself. Dr. Otaka said, if you guys have any questions, this is just the beginning. We're gonna keep things rolling. We got him coming back again every month, the last week of the month. So we got him coming back November. The last week of the month will be the 28th. November 28th, same time, same place, or maybe earlier. He will pick topic for a discussion. If you have anything that you would like to talk about, please feel free to inbox me or inbox Dr. Dixon Otaka or Jacob Anderson II and let us know what you would like to talk about, and we'll get it over to Dr. Dixon Otaka. You can look
Mhm.
him up on Facebook and or any other sectors. And thank you so much. We've had a great time here on Winding Down Late Night Conversations. I am Pavani J, CEO of Exquisite Magazine. I'm sorry, not magazine. God is good. We're about to do something here. About to do something. I'm sorry. CEO of Exquisite PR Firm. And we have to the left of me.
Dr. Tucker Dixon, specialist OBGYN, and that's all for me.
Tired.
Yeah.
King Jacob. You can also reach me at Jacob Anderson II, music influencer, community activist, motivational speaker, radio personality, and most of all, man, a researcher and a learner, all the way, all the time. So it's been wonderful tonight, Dr. Taka. We definitely appreciate you. I
Thank you
learned so
so
much
much.
from you tonight.
Thank you
Thank you
so
so
much.
much. Bye bye.
Talk to you soon. Have a great morning.
Okay.
Good night.
Yeah. Bye.
Bye-bye.